Hey, this is Dr. Ben Pearl with FitFootU. So I was discussing with my patient advocate colleague, Craig Thompson, the conundrum that we face with healthcare right now. It's kind of a maze, isn't it, Craig?
It really is.
And, we were talking and we were trying to say, how could we express this visually, almost like Sesame Street? And you came up with a Venn diagram. And then it was like two mad scientists. I said, well, yeah, we could do that, but what about the silos and doing farm silos of the disconnect between the providers? So without further ado, Craig, you're going to lead it out from a patient perspective of where we sit in 2025 with, the myriad of healthcare options and the confusion.
So, Dr. Pearl, in one such example, we have a patient that's presenting before the PCP with some type of a muscular problem. We don't know if it's tendinopathy, a ligament, a strain.
And he's the gatekeeper, Craig.
Yeah, so the PCP is right there at the top of the food chain, or the initial point of entry.
Okay.
This is the initial source where the referrals start
So
to begin.
the patient, let's say the patient has a muscle weakness, and then what happens, Craig?
So the PCP is then kind of in a bit of a conundrum at this point, and he's got to make a referral. Now, he's got all these different optionalities that he can refer to. He'll start with a conservative modality first. Once he's exhausted that, the referrals will start, and that's where we get into all of these siloed, compartmentalized, and hyper-specialized areas that don't really communicate and talk to each other.
There is a little bit of overlap I saw on some of this, but sometimes in the initial triage, let's say he sends to his buddy an orthopedic surgeon because he thinks he's got just weakness in the joints or a joint that's inhibiting him. But then after that, orthopedic says, this isn't the problem, it's more muscular, then it's more neuromuscular. Then what typically happens with the PCP, Craig? What would be, give me a scenario.
So at this point, we've now got referrals within referrals, and we're now getting referred to subspecialties within other specialties. And so maybe he's actually gone to pain management as well, and he's gone to sports medicine.
Okay.
Perhaps he's done physical therapy. Perhaps he's gotten some non-operative injections because the orthopedist said, you know what, this is not a candidate for surgery. And then that led to the more testing, the path